Welcome to this episode of Youth Diary. Today we have Dr. Mohammed Zabeer, who is a consultant in accident and emergency at Renai Medicity, Palarivattam. Welcome to the show, doctor. So, doctor, can you tell us something about an unresponsive status of a patient, and if you can also tell us something about the basic life support.
Okay. Like suppose if a person is seen unresponsive,
what is the next immediate step a person is supposed to take?
Okay, so if you see someone like unresponsive, the first thing what you have to do is to check for the pulse. Where exactly is over the carotid region, that exactly over the right side of the or the left side of the neck. You need to check for the pulse. If it is absent, the first thing what you have to do is start the chest compression. And chest compression, how you have to do is like, first you need to keep your heel of the hand over the chest, and with the other hand you need to interlock of this area like this, and you need to start compressing, and the force should come from the shoulder, not from the elbow. It should be like this: 1, 2, 3, 4, 5. Like this, you need to count up to 30. After the 30, you need to give a 2 breath. This cycle has to go for 5 times, like 30 compression with 2 breaths. So this has to go for the 5 cycle. After 5 cycle, you need to check for the pulse. If the pulse is present, well, it's good, the patient has come back. If it is not there, you need to continue for the chest compression and breath. If you want to shift the patient, you should not waste time. That means like you should not stop the compression. You should keep on continuing the compression till you reach the, till you get a help, or if you're transporting the patient to the hospital. So what you have to do is like you need to continue the compression and followed by the 2 breaths. When you reach for 5 cycles, you need to stop it and check for the pulse, and during that time you should keep moving it, but this shouldn't exceed more than 10 seconds, because if you stop the compression, the chances of getting back the patient will be reduced 50%. So what you have to do is, as I told, if you see an unresponsive patient, check for the pulse. If pulse is not there, start the compression, that is 30 compression and 2 breaths for the 5 cycle, then stop, check for the pulse. If no pulse is there, continue it, and during that 10 seconds, during that period, you need to keep moving the patient, and you should not interrupt it.
And also, can you tell us something about the advanced life trauma support?
That's basically when you see someone who met with an accident, or if an history of fall from a building, or any trauma patient. So if you see someone in the road or something like that, the first thing what you have to do is like you have to stabilize is the airway. Airway means like if the patient is turned upside down or like in the straight, and you need to stabilize his neck and the airway. So mostly what happened was, if you see someone in the road with an accident, normally people used to carry them, like put it in the car and they used to get. That's actually not good for the body. So when you see someone who's met with an accident, there are chances of the patient's getting a cervical injury. So you need to stabilize his head. When you shift someone, you need to hold it like this below his neck and stabilize it. Then you need to shift like this with the other part of the body. Okay.
So, doctor, we have the next mail from Rajiv. This is regarding CT scan. My wife had slipped and fell in the toilet last month and injured her head, which needed stitches. Similarly, my friend met with an accident and injured his head, and CT scan was done for him. My question is, why CT scan was not done for my wife for the similar case?
Not all head injury requires a CT scan, like especially when a patient comes to the emergency department or a hospital with a history of a head injury. Normally we see whether the patient is having other findings with that. Example, if the patient is vomiting more than 2 episodes, or if he's having loss of consciousness, or if suddenly he's having a seizure, that is convulsion, or if the patient is having any kind of basal skull fracture, like the patient will be having blood which will be clotted around the eyes, all those things. So there are some criteria. If such things are positive, then we'll do a CT scan. It's not like if a patient comes with a head injury, we'll go directly with a CT scan, because it's about the radiations. It's not good for the body. So if a person who's having a head injury with other signs like what I mentioned, if any of those things are positive, then you will do a CT scan. So maybe the second one, he met with an accident. So that comes in a criteria where maybe the pedestrian with the vehicle or something like that. So that's one indication which we have to do a CT to find out is there any internal hemorrhage or any abnormalities. So in such cases we will do yes. But the other first one, what you said, like a slip and fall, and if she didn't have any loss of consciousness, seizure, nothing was there, then there's no need of doing a CT for her. The only thing what you have to do is like observe for 24 hours. If any of these signs are present, then they have to do a CT, otherwise no need.
So Rajiv, I think that he has answered your question. Doctor, basically we have this question regarding unresponsiveness of a patient. If we find a person in an unresponsive state, what is the next immediate step that we have to do? If you can tell us something about that.
Okay, so if you see someone who's unresponsive, the first thing what you have to do is check his response, see whether the patient is responsive, and if you confirm the patient is not responsive, call for the help. The next thing what you have to do is check for the pulse of the patient. That exactly where you have to do is on the right side of the neck or the left side of the neck. In a normal patient, when you keep these three fingers, you can feel over it. If the person is not responsive, the pulse is not there, you won't be able to feel it. And when you confirm there is no pulse for the patient, what you have to start is a compression, chest compression. And how to do that thing is, you need to keep your left hand like this straight without bending the elbow, and the right hand on top of it, and the heel of the hand should rest over the chest, the center part of the chest, and you should start compressing like this. The power should come from the shoulder, not from the elbow. So it should be 1, 2, 3, 4, 5, 6, and you need to do this for 30 times. That is 30 compression. Followed by the compression, it is the 2 breaths. Now you should give a mouth to mouth. If you know the patient, or you can keep some barrier putting kerchief or something like that, you can give it 2 breaths. Okay, so this is how it has to be. 30:2. You have to do this for 5 cycles, 30:2, then again 30:2, and again 30:2. After the 5 cycles, you need to check for the pulse whether it is present or not. If it is present, yes, you got the patient back. But if it is not that, still you have to continue the chest compression till you get him back. Now the question comes, if such thing happen at home, what you going to do? The first thing what I said, when you find the patient is unresponsive, I told you to call for help. In that case, the ambulance, all those things might be coming. In the other way, if you're trying to get the patient from here to there, now how you are going to do it? As I mentioned, when you do a compression 30:2, you'll be stopping to check the pulse. That shouldn't not exceed more than 10 seconds. So what I'm telling is you should not take for not more than 2 or 3 seconds. Check for the pulse if it is there. If it is not there, shift him over the next step. So like that, keep doing it. So get him to the taxi, or get me your car, get me to the hospital. But even when you're traveling, you should not stop the cycle 30:2. Okay, so when you reach the hospital, then doctors will take it from there.
So now we have our audiences asking us questions. This is the first question.
I am Jasim Bakar. I am from KME Engineering College. I stay in an area where snakes are very common. So I have a doubt. What are the first aids when I see first is snake bite?
This question is regarding what is first aid, what we have to do when you see a snake bite. So when you see a snake bite, the first thing what you do, you need to confirm that it is a snake. Whether the snake has bitten or not. And if you find out it is there, then what first thing is you need to immobilize the area, just like how you put a plaster. If you have a splint or something like that, you need to just keep over the leg, below the neck, just to prevent the movement. The second, something which you should not do, that I'll mention about doing it. Most of the people, what they'll try to tie it. Applying a tourniquet. That thing is not at all practical right now. So you should not put in a tourniquet. You should not cut or suck the blood. That is not there. You should not do that. Actually, when you are getting a direct contact with the venom. So the patient who's trying to save them, even that could become a patient. So so don't do that thing. So immobilize the area. Don't put a tourniquet. If you want, you can put a construction band. Third one is, don't try to cut or suck the blood out. And most of the time what happens is the person get bitten when they try to catch the snake. So I don't I don't advise them to try to catch the snake. So let it be. If you got bitten, come to the hospital, like how I said, immobilize and get him to the hospital. Rest we'll take care. And about the snake bite, we have 4 different families which is there in India. Out of that, only 2 are common, which belongs to Elapridae and Vipridae. So basically we need to differentiate whether it is the neurotoxic or hematologic. Those parts will be done by the doctors in the hospital. So as a common man, what you have to do is immobilize the particular male which it got bitten, and get him to the hospital as soon as possible.
So that answers your question, and don't try to be heroic and do things that is normally shown in TV. I don't think that is advisable. So we'll go to the next question. This is the next question.
I'm Divya from KME Engineering College. I wanted to ask, I got bitten by a cat recently, so should I take medicine for that?
Yes, cat bites requires treatment. In fact, the studies have shown that the cats are much more dangerous than the dog bites. And even in case of the dog, it is only 1.6% to get rabies, chances of getting rabies. But in case of cat bite, it is 3.6%. So yes, that requires a treatment. Now, how do we decide the treatment? It's basically there are 3 different grades. The first grade is like if this cat or the dog, if they just lick in intact skin, that is grade 1. In that, you don't require any treatment. But in a second grade, that is when there is a scratch with the teeth or with the claws of or the nail of the dog or the cat, that requires treatment. That requires tetanus, rabies vaccine, and antibiotics. And the third one is a drop or a puncture of a blood which is coming out. So the grade 1 is licking in an intact skin which doesn't require anything. Grade 2 is a scratch with the nail or the teeth, that requires antibiotic, tetanus, and rabies vaccine. But the grade 3 where the blood comes, you require something, also you require immunoglobulin. The immunoglobulin, there are of 2 types. One is the human made and one is the horse made. The horse made, which is given according to the body weight, that is 20 international unit into body weight. So if a normal person comes with 60 kgs into 20, that much amount of immunoglobulin has to be given. That the study showed that you have to give around the wounds. If anything is left, then you have to give up to the butter. But the latest study shows you have to give around the wound itself. So that's about the immunoglobulin.
The question is this.
My name is Ramzik. I am from KME Engineering College. So I do have a doubt. I often get bleeding from my nose. So what could be the reason for that?
Normally, if a person get a bleeding from the nose, it is called epistaxis. So it happened from anterior part of the nose and also from the posterior part of the nose. And 90% happen from the anterior part of the nose, and the rest 10% happen from the posterior part of the nose. Different causes of the bleeding from the anterior part of the nose are: first is trauma, the patient having any bleeding disorder, or if nasal pricking, or any neoplasm, that is any cancer. So all this can cause nasal bleeding. And from the posterior part of the nose is basically due to high BP. So we have to evaluate, we have to see, we have to find out what is the cause, whether it is an anterior or the posterior. So according to that, we need to treat.
This is the next question.
Myself, Vishnu Suresh, an engineering student from KME Engineering College. Doctor, I have a doubt for you. That there are different types of chest pain, such as chest pain due to stroke, chest pain due to gas trouble, and etc. Of these, what kind of a chest pain should I consider is an emergency?
Okay, it's pretty tricky question. What chest pain should I consider as an emergency? So if you ask me, what I say is like all the chest pains are emergency. There are 10 to 12 causes of chest pain. So the first one is the myocardial infarction. I'm giving some example: myocardial infarction, aortic dissection, muscular pain, pericarditis, myocarditis, pneumonia, pancreatitis. All this can cause chest pain. So but that requires an evaluation. So if a person comes to emergency department if complaining of chest pain, so what we do is like we do a ECG, we see whether any abnormality is there in the ECG, and we repeat the ECG after 1 hour. And if the pain had started within 6 hours or the 4 hours, we do some blood investigation also. So basically we have to evaluate them. So we can't say that which chest pain is an emergency, which is not an emergency. So for me, according to me, all chest pains are emergency. So that requires an evaluation. So only after the evaluation we can say whether it is an emergency or a non-emergency.
So we'll go to the next mail. My name is Deepak, and I am allergic to honey sting. I was stung by the bee twice, and both the time I developed severe allergic reactions and hospitalized. I was in a very bad condition that I had been breathless, and swelling of lips and tongue was also there. This happened to me twice, not once. Is any precaution that I can take? How can I be better prepared?
So he was having actually something called as anaphylaxis. So that developed because of the honeybee sting. So the treatment for us immediately he has to be taken to the hospital and he needs some injection. But in this question, so he was asking, he frequently gets the honeybee sting and he used to develop the anaphylactic reaction. So he's asking me what he can do. So in this, there's something called as EpiPen. That's a pre-filled adrenaline which is present, which will be available in most of the hospital. So you can carry this thing with you. So next time when you get any bee sting or an anaphylactic reaction, you can just inject over your thighs. So that will be helpful for you. So especially in this cases, yes, it will be helpful for him. So there's a pen which is available in most of the hospitals.
So Dr. Mohammed, it was nice talking to you. It was really a valuable time that you spent with us because it was really informative. So you will have more questions for us. Don't worry, you can keep writing to us on youthdiary@rosebowl@gmail.com, and we will be coming back with your answers next week. Till then, bye-bye.